Breaking news. Gigantists are spotted walking across town wreaking havoc as they go. Beware as they might be coming your way. Now, what is gigantism? We will be going over what it is, what causes it, who is most likely to get it, from risk factors, signs and symptoms, diagnosis, and treatments for this disease. Now, on to Johanna for what is gigantism.
What is gigantism? Gigantism is a condition characterized by an abnormal growth within the body. The most common display of gigantism is however, it has also shown to increase bone size of the hands, feet, and the face, which is also known as acromegaly.
What are the causes of gigantism? The most common cause of gigantism is a non-cancerous tumor that is affecting the pituitary gland. The pituitary gland regulates growth via the growth hormone, which is what the tumor is compressing and throwing off, aka causing the unchecked growth in gigantism.
Who is more likely to get gigantism and what are the risk factors? Patients with the genetic condition Carney complex have a risk of gigantism because this condition causes benign tumors in the skin, the heart, and the endocrine system. The pituitary gland is a gland within the endocrine system, therefore it is affected by the Carney complex. McCune-Albright is a genetic condition that affects the bones, skin, and endocrine system, causing scar tissue on the bones and precocious puberty. Multiple endocrine neoplasias are genetic conditions when one or more of someone's hormones are overactive and or form a tumor. Specifically for this disease, it would be the growth hormone. Neurofibromatosis is a part of a group genetic condition called neurocutaneous disorders. These disorders cause an abnormal increase in cell growth, which leads to the formation of tumors. And finally, familial isolated pituitary adenomas is an inherited condition characterized by the development of pituitary adenomas or a non-cancerous tumor.
What are the signs and symptoms of gigantism? The most common symptoms of gigantism include a large head, a very noticeable forehead, a jaw that seems to jut out, unusual features of the face such as a broad nose, large hands and feet, increased sweating, a very large appetite, and just general weakness and fatigue because your body is trying to compensate for the increased growth. This is an example of what gigantism may look like.
What tests are used to confirm if someone has gigantism? Diagnostic tests include growth hormone blood test, which is when an IV line will be used to draw an initial blood level. Then the patient will be either given clonidine or glucagon, and then blood samples will be taken every 30 minutes for the next 4 hours. Another test is the IGF-1 blood test, which is simply a blood sample which is sent to the lab, and then results will be sent back to the patient and the doctors. A glucose tolerance test. An initial sample of blood is taken, and then the patient is given a liquid containing a specific amount of glucose. Then blood samples will be taken every 30 to 60 minutes for up to 3 hours in order to see how glucose is filtered in the body. And finally, imaging tests. If gigantism is confirmed, a physician will order an MRI or a CT scan in order to show the size and or location of the pituitary tumor.
Now on to the treatments for gigantism. Is there a cure? Treatments for gigantism include regulating, reducing, and monitoring the growth hormone. This will be key in trying to control this disease. They also can help regulate IGF-1 levels, and on the more extreme side of treatments, there will be radiation and surgery. Surgery could be conducted to remove all or part of the tumor to help decompress the pressure on the pituitary gland, to help make the disease more manageable and help manage the growth hormone, and radiation levels to help lower growth hormone levels by reducing the tumor. Now, thank you for listening for today's podcast on gigantism. for February 22nd, 2023, Attack of the Giants. To be continued.